purpose of attending the Southeast Asia's Breast Cancer Symposium was to conduct a 3-hour oncology nursing workshop for capacity building of these nurses and the conference participants who provide care to patients with cancer. As you may also know that one of the major roles of nurses is prevention and also the management of symptoms and treatment-related side effects. So the International Society of Nurses in Cancer Care, and the short term is SNCC, worked together with the nursing team of the Hoi Central Hospital in order to design the oncology nursing workshop for capacity buildings for nurses. And actually, this workshop consists of 2 topics. The first one is management of extravasations, and the second one is symptom management in palliative care. So apart from me and the nursing team of Hoi Central Hospitals, so Ms. Alisa Grissom from the University of Pennsylvania and Dr. Carmen Kwok from the Haven of Hope Sister Annie Scout Holistic Care Center also participate in this workshop and share with the participants about their expertise and knowledge. I would like to share with you more about the details of this workshop and why this is so important in order to make use of this platform for training the nurses in the symposium. Now, actually, chemotherapy is one of the primary treatments for the patients with cancer, and the intravenous administration is commonly used for chemotherapy. Now, however, chemotherapy drugs, which is classified as vesicants, can cause tissue damage and even tissue death. So if the drugs accidentally leak into the surrounding tissues, like intravenous catheter infiltrate into the surrounding tissues of the administration site, it will happen, extravasations. So in this workshop, the participants were expected to gain knowledge about the chemotherapy drugs classified as vesicants, what are the preventive measures of extravasations, how to monitor for the extravasations, as well as the emergency management if extravasation is suspected. And we also provide the several case studies to the participants so that they can discuss with one another how to deal with those incidents. And another topic for this workshop is related to the symptom management in palliative care. Now, according to the WHO, palliative care is an approach that improves the quality of life of patients and their family who are facing problems associated with life-threatening illness. So therefore, relieving symptom burdens and suffering of the patients with advanced illnesses is one of the major goals for providing palliative care. And also it is also one of the role of the nursing when they deliver the palliative care as well. So in this workshop, participants were expected to have better understanding about what is palliative care and the principles of palliative care, what are the common symptoms in advanced cancer illnesses, and how to conduct the assessment and how to manage the 4 common distressing symptoms in patients with advanced cancer. And the 4 most common symptoms for those patients with advanced cancers are pain, breathlessness, nausea and vomiting, and fatigue. And we also provide the case studies regarding the total pain management in order to highlight the importance of using multidisciplinary approach for effective symptom management. And I would like to also share with you, the feedback of the participants. And in fact, we are very glad that the workshop was conducted very successful because many nurses and the conference participants attended our workshop. And SNCC is also very delighted to continue collaborating with the breast cancer clinicians and also the advocates across the Southeast Asia in order to provide training and capacity buildings for nurses in Southeast Asia's Breast Cancer Symposium. I just want to say, to take this opportunity to thank symposium organizers because they have done a very great job in order to share the new knowledge about the breast cancer and also provide such a good platform for us to provide the training and the capacity buildings for the nurses in Vietnam as well as the Southeast Asia. And I look forward to having more opportunity to collaborate with them.